Welcome, everyone. We're just letting folks in from the waiting room. Give us another moment. All right. My name is Margie Beaudry. On behalf of Trust for America's Health, I'm very pleased to welcome you to today's Huddle call to discuss challenges and solutions to ensuring access to the COVID-19 vaccines for older adults and people with disabilities who cannot leave their homes. Please mute your lines unless you are speaking. This session is being recorded so that we can capture all the ideas and experiences shared. This call series is part of an initiative to identify and foster adoption of innovative and promising practices on this topic. This work is made possible through the generous support of the John A. Hartford Foundation and the Cambia Health Foundation, both of which are dedicated to improving health for all. When TIFA began this initiative in February, very little was known about the challenges of ensuring that older adults and people with disabilities have access to the COVID-19 vaccine. Since that time, CDC has produced guidance, additional funding has become available through the Administration for Community Living, which we heard about last week, and there has been much media attention focused on this issue. Working together with many of you, we've developed a set of policy recommendations that will soon be published and disseminated to help inform and guide policy leaders across the country, as well as some very practical guidance that will be posted on TIFA's website very soon. Despite increased attention to this issue, there are still a lot of complexities, including the developing situation with the J&J vaccine pause, and many states and local jurisdictions have not yet fully identified their homebound populations, nor have they been able to implement systematic strategies for vaccination distribution to those at home. Our speaker today, Dr. Adrienne Griffin from the Association of University Centers on Disabilities, will be sharing some valuable information on AUCD's Emergency Preparedness Initiative, Prepare for All, as well as their upcoming vaccine confidence efforts focused on people with disabilities. After her presentation, we will open it up for discussion and questions. And with that, I'll turn it over to Adrienne.
Thank you so much. Well, it's a pleasure to be with you today. I just have a few slides to guide my remarks. I know we've all been in back-to-back Zooms, and sometimes you just kind of think, oh no, more PowerPoint, but bear with me. I hope that I am engaging enough to keep your attention for the next 10-ish minutes or so. So I just wanted to give you a bit of background on two initiatives. One is our Prepared for All Emergency Preparedness Initiative that we have a whole cadre of materials developed on that I hope are also helpful to you in the good work that you're doing. And then at the very end, I just wanted to sneak in a little preview of some upcoming vaccine confidence work. So with that said, let me just jump right in. So if you go to the next slide, emergency preparedness is part of our health disparity focus. It's a lens that we use as one of our focus areas on health disparities. This is our framework for our National Center on Disability and Public Health. Within that National Center on Disability and Public Health, we have another focused technical assistance center on emergency preparedness, and that's where the Prepared for All initiative fits in. So if you remember nothing else from my remarks today, I want you to remember that we want to work with you. We want to really collaborate with you on a local and very practical level. We know that emergencies happen all the time, and you have to be thinking about this all the time, not just at the height of a pandemic, but really weave it into what you do. So please take that with you today. And really the other focus piece on this slide that I wanted to say out loud is that our motto is public health is for everyone. And that includes everyone in the community, including the 1 in 4 Americans who have some kind of a disability. So let me just keep going. I wanted to go to the next slide here and give a little bit of background on the AUCD network. I know some might be familiar with us, but some may not. But we have a presence in every state and territory across the country. And really our mission is to make sure that people with disabilities can live well across the lifespan. We do that through advancing policies and practices that improve health, education, social and economic well-being, as well as families and communities, because we know that that's all in the mix. It's all important. So our network really bands together to help address how people with disabilities can live better across their lifespans. And how we do that is by looking at what are those barriers to inclusion and wellness, and how do we keep that moving forward and cope with the COVID moment that we're in right now. That really is our current challenge, and we have those tools to apply to that as well. I am a bit biased as a doctor of public health. Our mission is quite big, as you can see. I like to remind folks that if you are not healthy and well, good luck getting a good education that then moves you into living well in the community, that then moves you into working and having a livelihood. So I like to say that health and the work of our public health team is really foundational. So I think that that's really all I wanted to say with this slide as well. So no matter where you are across the country, there's a AUCD Network Center who would be more than ready, willing, and able to partner with you. So just a little bit more about the Prepared for All initiative, if you go to the next slide. So don't get into it now. So this Prepared for All initiative flows through our CDC cooperative agreement, and it's really focused more on preparedness, although we have really used the COVID-19 moment that we're in right now to frame out particular examples as we look at really mobilizing local disability organizations to foster connections and trust, right, between public health planners and emergency managers to get a seat at that planning table. You can do a lot of work in a vacuum by accident if you don't have partners at the table. So our whole emphasis for this initiative is to make sure that you have the whole community at the table, and the whole community includes people with disabilities. So our approach is really to train and support disability organizations at a local level so they can be building these connections, building these relationships all the time so that they have them when they need them. So our primary audience is disability organizations. However, there's such a variety of content that we have available. It really enables disability organizations to have the vernacular, have the lingo, know the terminology to have conversations with emergency managers and public health professionals, that those are also secondary audiences as well as health professionals. There's a little something for everyone here, as I like to say. So if you go to the next slide, what I wanted to do next was to just give you like a snapshot of how we've pulled this together. We have our community of partners. There really are advisors and subject matter experts, but then our initiative really flows down to 3 separate but very interrelated efforts. We have monthly town halls, which you're all very much invited to. We just had one today. We actually have these every 3rd Wednesday of the month at 1 p.m. Eastern time, where we really dig in and do some, I'll say, vulnerable problem sharing with each other about what's working, and also like success sharing, what's done, what we've done well, what we could maybe emulate, if there's any good strategies out there. So that's what our town halls are about. It's very much about appreciative inquiry, looking at where are our strengths, what's going well, how do you keep going and really support each other. So that's our monthly town hall. We also have our online training, which is very much from a whole community perspective. And I neglected to update this. We just launched it. We're no longer in pilot testing, as this slide says here. We are out now with very, I think it's like, it gives a overview if you want it, but it also goes down into very specifics around the American Emergency Management System, how regional and local public health planners might look, and how to connect with that and really bring in disability inclusion perspectives throughout that process. So that's our online training. And then another complementary strategy we have is what we call our disability inclusion coaches. We have in the AUCD network a couple different types of centers. And that's what this alphabet soup is, or USEDS and LENS are types of university centers within our network, but we also have public health trainees as well through sister entities. So we are inviting these trainees as they're getting their practicums lined up this year, or perhaps if they need to adapt and do something virtually, to use this as a platform to build out that network locally where they are, to really be that voice at the table to make sure that people with disabilities in the community are part of those conversations. So I'm happy to say that just this last week, we now have 14 disability inclusion coaches collaborating with us, and we're looking to expand that as we go. So all of this really flows to the local community. We're hoping that we can inspire some prepared for all action teams as we have here in that bottom purple box, and that all of this goes to partnerships locally with emergency planners and public health departments. So that's the name of the game, to make sure that we're incorporating people with disabilities and planning in advance of any emergency. So if you go to the next slide, I wanted to just give you a peek at our evidence-based approach. I did share a moment ago that our town halls really blend in an appreciative inquiry perspective, but we also, I'm sorry, I'm getting a lot of feedback. And some buzzing.
Yeah, I'll ask everyone to please mute your lines. We're getting some feedback. Let's see if that works any better.
Thanks. So we really are blending appreciative inquiry as well as a little bit of motivational interviewing with some action research that we are learning as we go, but also really inspiring our partners to not stay bogged down in what's not working, but look at the glass half full where you're strong, and really how can you resource those assets in the community and think about what you need to do to keep going forward. So we have what we've prepared here on this graphic is our Prepared for All wheel, where at the center, our core is that we are making sure that we're sharing information at the same time. We're to everyone, no matter how they communicate. We call that principle same time access to everyone, or STATE. So that's really, really critical. The other part of the for all that is at the center of our approach is that all local partners own and share the issue. It's not, oh, that belongs to EMS, or oh, well, the fire chief does that, or oh, public health, but it's everybody. So that's what the for all means. And then we have the mnemonic where each letter stands for some other phase of the approach. And I just wanted to quickly go through. So it's prepared for all. So the P is pinpoint, really just bringing awareness to who's doing what in your community. Can you name them? Can you pinpoint who does what? R is for relate. Can you think through what you do in common? Where are your shared agendas? Where are your shared, perhaps overlapping missions? What's the relationship? How could you work together? Then that leads into E, which stands for engage, just trying out a practical collaboration. What would that look like? Then the next P stands for being positive. How can you engage with each other? Look at what resources you might bring so that you're able to continue to appreciate what you might do that's different, or appreciate what you might have that is unique. That all goes to then trying something out, taking action, or advancing, moving forwards. That's what the A here stands for. Just trying, doing something together, keeping going, advancing all the time. And then R stands for taking a moment to pause and reflect what you're doing, thinking about how that you might need to pivot based on what you've learned. We all know that you can write up a great action plan or a great work plan, but you need to be nimble and changed based on what you're seeing in live time. So that's really what that R stands for in reflecting. The next E stands for envisioning, and that's really where in this process we encourage partners to think about where they want to be in the future and where they are right now and what they need to do to get there. And then the last letter D stands for deploying, where you pull all of these assets together and you really work toward doing inclusive whole community emergency planning. So that's like the nerding out behind the scenes evidence approach behind the Prepared for All. So if you go to the next slide, what I wanted to do next was to just share how we look at this a little bit differently than perhaps a more technically focused emergency planning effort. This is really about how you might adapt this for your local needs. So it could be everything from you're going to use this approach to review alerts to make sure that they're accessible, that you really are sharing information in the same time to everyone. Or right now with vaccinations for COVID-19, are the dispensing sites accessible? Have you brought in all of the different supports that you need to make it accessible to people with disabilities across the different communities? So these are just quick examples here. If you go to the next slide, wanted to just take a moment to go through what you might pick up from our online learning. We have just launched this, and I have the link in a future slide, just launched this the week before last, and it's interactive online training module series so that you can take it whenever you might have a moment. We also have 1 minute high level versions of each of these modules. You can get into the weeds if you have time, but if you don't have time, we want to just make sure that you get the high level, very basics. So we have a 1 minute version for each of these. And then for each of these topics, we also have a companion module that really gets more into the nitty gritty. We have this simulation role play based in a fictional Disasterville, USA, where the learner takes on a role and meets with the emergency manager in the county and the public health planner in the county and collaborates with local community folks and different leaders throughout the process. But just to go real quick through it, because I think it's really timely for the moment that we're in right now. It goes through COVID testing, a bit about emergency dispensing sites and how to make them accessible, thinking about the history of the effects of disasters on people with disabilities and this moment of COVID-19 that we're in right now. It also goes through a little bit on the American emergency management system, as well as gives an appreciation of disability demographics and living in the community, and just kind of reviewing information around communication and accessibility so that you're able to bring that into local emergency meetings. There's also a piece on whole community emergency planning, as well as the Americans with Disabilities Act and how it pertains to disasters and pandemics and responses. And then finally, there's a culminating community stakeholder meeting where you really practice everything that has been taught in the previous 7 lessons with an actual workbook on how to do it. So I think that's really key for this moment right now. So if you go to the next slide, what I wanted to do next was really just invite you again to work with us. We have our website, which is nationalcenter.dph.org/our-focus-areas/prepared for all. That then will lead you to our information on the training, as well as our town halls and our disability inclusion coaching program. So those are really the 3 main ways that we would invite you to collaborate with us and work with us. We are very much collaborative in our nature, and emergency response and planning is local in nature as well. So with that said, what I wanted to do next, if you go to the next slide, just wanted to give you another resource that we have on our public health portfolio. It was our Public Health is for Everyone toolkit. Wanted to bring this up because we have a few news sections. We're adding resources every day on disability inclusion and COVID-19 response, as well as some other really good materials in terms of access to healthcare and emergency planning that you might find useful. So that URL is www.phetoolkit.org. And then last, and like the last minute that I have, because I've been timing myself, I've been trying to be good. Wanted to also just give a shout out. I have a hyperlink in the slide, which I think you all will get the slides. Is that right? Because I have that. Perfect. Okay. So we have a new project that's just about to launch in the next week or so around vaccine confidence and access for people with disabilities. And we are, part of what we're doing is gathering success stories about strategies that are working well at that regional and local level. And so I'm really happy to highlight a success story from our New York suburban, it's like the New York suburban area. If you're familiar, Westchester County is a county right outside of New York City. One of our university centers is located there. And they talk in this success story about the process of becoming a vaccine distribution site dedicated for people with disabilities and how they were able to collaborate with Department of Health in that state to become a designated regional center. So that is coming up. It's already on our website, and then we will have more information and more materials for partners very, very shortly. And with that, I just want to thank you. Contact information is on the next slide, as well as contact information for colleagues who collaborate with me on the Prepared for All initiative. And if any of you are interested in working with us as a Prepared for All partner, we welcome your partnership, and we have a short interest form that is linked on this URL here. Those were my remarks. Thank you so much.
Adrienne, thank you so much for that wealth of information. We do have some time for questions and discussion. I'll invite everyone to either put a question in the chat, or you can raise your hand in the Zoom and we'll see it there. I'd love to just kick it off a little bit. I know that you mentioned at the end that you're putting together an initiative around hesitancy and trying to address that within the disability community. Obviously, this is something that's been in the news a lot. We've heard a lot about this across lots of different groups. So I'd love to hear sort of what you already have observed. Sort of what is that in response to, I guess, the issues around vaccine hesitancy that you're hearing, and what can be improved in order to improve receptivity around the COVID-19 vaccines?
Sure. Well, thank you for that question. So our work is really focused on building vaccine confidence and making sure that sites are accessible. We're finding that many people with disabilities would like to get their vaccinations, but are having issues with the accessibility of booking of the vaccination appointment, or perhaps getting to a site and then finding that it's not physically accessible. We're also finding that there are a couple key influencers for people with disabilities, namely families and the direct support professionals that support some people with disabilities. Sometimes their sense and their opinions really do matter and influence the decision to on or not whether to vaccinate. So those are the pieces that we're finding now. And there's a lot of variation regionally, locally, whether you're in an urban or a suburban or a rural area, there's a lot of variation. But those are the basic pieces that we're finding right now.
Thank you so much. There's a hand up from Kalkidan Kestad. I hope I didn't massacre your name. Go ahead.
No, you're good. Thank you. So I had a quick question in regards to your town halls. I'd like to join it. I'm from Washington State DOH. And
Wonderful.
I'm wondering, in those town halls, will I be able to connect with is there going to be local representative from Washington State that's going to be in those town halls? Because I'd like to know, how to identify those individuals that are having these barrier issues, because that's what my task is, to figure out the barriers and come up with solutions on how we can accommodate everybody. So if it's something obtainable within those town halls, I'd love to invest my time and kind of collaborate with you guys on that.
That is wonderful. Music to my ears. Thank you for that question and comment. Yes, definitely the town halls are spaces for practical troubleshooting, problem solving, and we would be able to connect you either live in that space with others in your region, or perhaps in advance or as a follow-up, we could make those connections in your region. We do have a pretty active set of centers and partners in your region. So I would be most happy to make those connections even before our next town hall, so that you can have some of those connections going and then have a really good fruitful exchange in that next town hall meeting. Just so all of you know, our town halls are open, so you're welcome to come every time, or as much as or as little as your schedule permits. We do also take note of the gems, the pearls of wisdom that we hear in those meetings, and we're in the process of pulling them together in what I lovingly call a playbook, because this is all new to all of us, this COVID moment. So we're documenting that in these short strategies of what's been effective. So that's another asset that we will be developing over time.
Megan Wolf from TIFA.
Hi, Adrienne. Thank you so much for this great information. And I love this real-time connection with some of our public health participants. So, right before this call, there was the White House Forum, right? And that's probably where many of us
That's where we were, right?
And, the primary focus was on individuals with disabilities and others who are homebound. And they had a lot of really interesting but disparate examples. So I'm wondering if you have additional examples. Is that what your playbook will reflect potentially, is some of these great examples of where there's systematic approaches to making sure that older adults and people with disabilities who are homebound are getting the vaccine?
Yeah, thanks for that question, Megan. Yes, we actually have been working with actually a couple of the examples that were highlighted. So that's wonderful. I was so thrilled to see the example from Missouri highlighted in that way. We are a sister grantee to the Association of State Territorial Health Officials with our Prepared for All initiative. And in fact, we've given behind the scenes advice as ASTO has pulled together those 12 disability integration specialists, and we've done some regional connecting for those specialists. So we are involved in the examples that were highlighted. And other examples that I would hold up, there's a lot of, I would just say, on the ground creativity and learning as you go that has been really inspiring. Just like yesterday, we were talking with our Tennessee center, and they were saying how in small towns, in their, through their research, they were finding that small town newspapers still exist. And what they were doing was getting out some templates to local leaders that they could take and then put and pitch to local editors to get the word out, to say, here's where the accessible clinic is, here's where you go, here's who you can call if you have questions. So I'm really just inspired by the local ingenuity and the humbleness of finding out, how do people get their information? What is the best way to communicate? And then pivoting, being very nimble to make that happen.
Great.
Well,
thank you so much.
yeah, thank you so much. And believe it or not, our time once again is up. It flew by. With that, let's go to the last slide. I want to thank everyone for showing up today, and thank you, Adrienne, for the wonderful information. We will be sharing the slides and the recording following this event. TIFA continues to host these 30-minute huddle calls on Wednesdays and Fridays on topics related to enhancing access to the COVID-19 vaccines for people who need them administered at home. Our next call is on Friday, April 23rd, and our featured speaker will be Molly Gurian from Leading Age. We hope that you will join us. As usual, I am pasting the link to the April Huddle Call registration in the chat. And I want to thank everyone here for all that you are doing.
Thanks, everyone. Thank
Thank
you,
you.
Adrienne. Really appreciate it.
Thank you. Take care.